Orthopedic surgery is very easy if you know the basics. As all of us know, most of the orthopedic surgery includes implants, grafts, staples, sutures. In this video, we will see common devices which we will use in orthopedic surgery and also how to code orthopedic surgery using these devices. So if you know the device name, you can code the or you can choose the appropriate CPT code or PCS code. If you want to master orthopedic surgery coding, watch this video until the end. So first, in orthopedic surgery, we have replacements. Okay, so mostly we will code hip replacement as well as knee replacements. If you want to code total hip joint replacement, we have two components. First one is stapler shell, which is having metal with liner. And we have femoral stem, which is cemented or uncemented, so which is useful for PCS coding. But in outpatient coding, we have only two components, stapler as well as femoral. And in the middle, we have polyethylene liner, so which will reduce the friction whenever femoral head will be in the stapler shell. So what is important here? If you want to code for replacement of hip, you have two components, stapler component as well as femoral component. So what happens sometimes documentation is unclear. So you can't understand whether it is hip replacement or knee replacement. So how do you identify? So by using these components name. For example, if your documentation contains stapler shell or femoral stem, so that time you need to understand it is the hip replacement. So don't think that every time physician will provide all the details. So we need to have the idea. So based on this stapler shell and femoral shell, we can code it as hip replacement or hip arthroplasty. Next we have knee replacement. Okay. So in knee replacement also we have three components. Lateral compartment, middle compartment as well as patellar component or compartment. Here physician will replace the damaged components and he will replace those damaged components with synthetic substitutes or metal titanium alloys. So this is the knee replacement. So here it is like hip replacement, here it is knee replacement. Next we have internal fixation. So mostly we will use internal fixation for ORIF. So open reduction and internal fixation. Okay. So internal fixation is the most important component of ORIF procedures. Okay. So what are the most common internal fixation devices? Cortical screws, cancellous screws, locking screw, compression screw, interfragmentary screws, locking compression plate, dynamic compression plates. So the documentation contains all these types of screws or plates. You need to consider it as internal fixation. Okay. Next, how do we code for long bone fractures like tibia? So in CPT or PCS, we have few codes based on intramedullary rod insertions. Okay. If the fracture is more extensive or more complex, instead of placing the plates or internal fixation, physician will directly place intramedullary rod, okay, which will be produced by titanium or steel. So what is intramedullary? So basically intramedullary means inside the or middle of the bone or medullary cavity. So here physician will not place the screws directly, physician will place the intramedullary rod in the middle of the bone or medullary cavity. So using intramedullary rod also we have few CPT codes. So it is very important for you to check the code descriptions whether patient is telling internal fixation or intramedullary rod. So next one is fractured bone, okay, with tension band wiring. So sometimes patient will use K wires or circles, okay. Most of the time these procedures are percutaneous procedures. So using the imaging guidance, patient will insert the K wires and he will fix the fractures. Next one is external fixation, unilateral fixator. Okay. So based on the complexity of the fracture, patient will decide he wants to perform internal fixation or external fixation. Okay. So we have one CPT guideline related to external fixation. If the code description does not contain external fixation, we need to code it separately. Okay. So that is the CPT guideline. For example, patient has performed the fracture repair. After completion of fracture repair, patient has applied the external fixation. So how do we code that one? So you need to check the code description for fracture repair. If that fracture repair contains external fixation, you need to code external fixation separately. If the fracture repair code does not contain external fixation, you need to code it separately. In external fixation, we have two types. Okay, unilateral and or uniplanar or multiplanar. So uniplanar means external fixation device on the only one side. Okay. Multiplanar means so this device is on the multiple sides. Simple. Okay. So here also patient will use the percutaneous pins, wires, carbon fiber or metal rods. Okay. Next we have circular ring fixators. Okay. So these we will not code mostly, but we need to have idea of this one also. So usually we will see it as halo. Okay, application of halo for cranial injuries. Next we have arthroscopic instruments. So mostly we will use these arthroscopic instruments for arthroscopy procedures. So what are those common? Arthroscope, cannulas, grasping instruments and resection tools and suture anchors for fixation of like fractures or any type of orthopedic components. Okay, so like that we need to understand here. So next we have spinal implants and devices. Okay, like pedicle screws, connective rods, crosslink, interbody spacers, cages for spinal fusion, artificial disc replacement. So these are the keywords for spinal implantations. So pedicle screw means basically pedicle is on the back side of the spine. So if the patient fixes the screw in the pedicle, we will call it as pedicle screw. Simple. Okay. So sometimes what happens after performing the spinal fusion, so in order to compensate uh, for removed disc, patient will place the cages or spacers. So those are also included in spinal instrumentation devices. Okay. And we have other devices like as we have discussed previously, like bone grafts. So you need to check allograft and autograft most importantly for spine surgery procedures. Bone graft substitutes, ceramic synthetic polymers, which is very useful for inpatient coders. Next, surgical suture materials like absorbable, non-absorbable. Okay. Next, we have surgical staples. So after performing the procedure externally, patient will place the surgical staples. So that time you need to understand that it is a orthopedic procedure. Okay team, I hope this video is very helpful for you. If anyone looking for medical coding jobs in UAE, US and India, please join in our WhatsApp group. Group link is the description of this video. And also if anyone looking for same day surgery training, IPDRG training, SCC training, CC certification training, please join in our WhatsApp group and also send WhatsApp message to 707-526-3939. If you like this session, please click on like button and share it with your friends.